Great. Well, welcome everyone to finally the 2023 state budget breakdown brought to you by Voices for Virginia's Children. I'm Allison Gilbreath. I'm the Senior Director of Policy and Programs at Voices, and I lead our policy team as well as specifically child welfare and most recently our early childhood education policy work. And Emily, do you mind introducing yourself?
Hey everyone, nice to see you on this Friday morning. Emily Moore, I use she, her pronouns, and I am the policy analyst covering our health equity and family economic security work here at Voices.
And we are excited that we have some new team members joining Voices who unfortunately couldn't be here today because there's so much going on. Two of our folks are in Memphis, Tennessee, where they're at a conference, a youth conference, doing all sorts of amazing things. And our brand new mental health policy analyst is at the governor's mental health task force meeting this morning. So we will be covering some of their information today, and we're excited for you all to get to know them a little bit more later this fall. So just quickly about Voices for Virginia's Children, we champion public policies that improve the lives of Virginia's children and youth, particularly in early care and education, family economic security, food access and nutrition security, child welfare and foster care, healthcare access, and mental health. And we do this, we focus on centering equitable and just futures for young people. Our policies that we prioritize are about helping children to grow and thrive, parents and caregivers having the resources that they need to support their families. We want all family and child serving practitioners to have the tools to serve and adjust trauma-informed and healing-centered ways. And we want that all constituents to focus on bridging gaps to equitably serve minority and historically marginalized communities. Some of the themes of the 2020 General Assembly session, which feels like forever ago at this point, the biggest one that we felt was mental health. We're going to talk about some of the significant investments in crisis services, school-based mental health, and workforce. Tax revenue was a big issue this General Assembly session, and I would say probably the key issue around this budget hold up that took us all the way until September. We're going to talk about some child welfare investments, as well as some significant investments in increased flexibility around our educational dollars in the state budget. And with that, I'm going to pass the mic to Emily Moore to get us started with children's mental health. Before I do that, I did want to say if you have questions as we are talking through this presentation, you can pop them in the chat, or you can, if there's a moment between our slides, just come off of mute and ask your question. We'd love to answer it as we go along.
All right. Thanks, Allison. So as Allison said, this seems like a lifetime ago, but I want you to put on your thinking caps and think all the way back to the governor's budget in December of 2022, when he released the Right Help Right Now plan. And that has really been the foundation for a lot of our mental health investments that we are seeing in this budget. For those of you not familiar, the Right Help Right Now plan is the governor and the Secretary of Health and Human Resources joint effort to really invest in the structure, the infrastructure of our behavioral health system, to move from a system that is siloed to a system that operates on a continuum, and to put the focus really on prevention while also bolstering and frankly fixing our crisis services system. And so we see some key investments here. As always, it is a work in progress, and there are additional investments that we will need, especially in our workforce, to bolster this plan. But we were really happy to see the $58 million investment that will expand and modernize our comprehensive crisis services system. Comprehensive being the word there. The focus will be on adding additional 24 or 23-hour crisis receiving centers, adding in more crisis stabilization units across our state, particularly for young people. Right now, we only have 3 crisis stabilization units, one in Richmond, one in Hampton Roads area, and then one down in far southwest. And so that really leaves out a lot of our central and northern Virginia neighbors and our young folks in being able to access some type of crisis support that is not an emergency room. And then they will also be doing some enhancement to the existing sites that are available to make them trauma informed, to make them healing centered spaces, and to make them more accessible to young folks and their families. We have a $10 million investment that will create 15 new mobile crisis units in areas that are considered underserved. That is really a drop in the bucket of what needs to be done. The Right Help Right Now plan aims for about 70 new mobile crisis units. And so 15 is a start, and we are glad to see that investment. There are also some of our CSBs that are doing mobile crisis and have used philanthropy dollars or other types of funding to create these mobile crisis units. So there is some flexibility there as well that's already taking place in our communities. We are excited about this one, $4.2 million in additional funding for children's behavioral health services. We actually put that line item in for the first time 2012, I think it was, 2012, 2013, to create a line item specific to child psychiatry and crisis and children's behavioral health services. This is the first increase since that. So it was 8.4 million. We are now bringing that up to $12.6 million. Unfortunately, the budget amendment does not include the language changes that we had hoped. Those language changes were included in the House's budget, but not the Senate's version of the budget. And so a little bit of work to do there to ensure that the money that we have put in for children's behavioral health and young folks' behavioral health support is flexible in the way that CSBs can use that money and make sure that it can be community-based and community-focused. They're investing money to create alternatives to emergency departments for psychiatric needs. So think of it as like just a specific standalone mental health emergency department, kind of like an urgent care for behavioral health, and having access to those. And then another budget item that Voices has championed is our school-based mental health funding. And so our former colleague, Emily Griffey, was able to get this into the budget in 2022. And now we are seeing an additional $5 million investment, bringing that total funding to $7.5 million for school-based mental health pilots that can be public-private partnerships, some really creative ways that schools have been able to integrate mental health into the school day for young folks. And then also a 10% rate increase, which equals out to about $30 million for the community-based services that you see here. I'm going to let folks kind of digest that list before I jump on to the next one. We've got some rate increases for crisis services, for intensive outpatient, therapeutic day treatment, peer recovery support. Really glad to see that included there as well. So as you can see, we have really gotten off to a strong start on our investments for our Right Help Right Now plan.
Emily, the 4.2 million, you mentioned CSBs with that. Is that specific and carved out only for CSBs, not private providers?
So that's in the grants to localities budget. And so DBHCS specifically puts that children's behavioral health money out into their CSB budget.
Got it. Thanks.
Yeah, sure. Thanks, John. Does anybody else have any questions about this before I jump into some other mental health investments? Okay, if you do, you can use the chat and I will check that. So a few other mental health investments that we're celebrating is increased funding for Step Virginia for their first 3 services, the same day access, primary care screening, and then outpatient services. This is really inflationary increase because things have gotten more expensive, but it is good that we have made that investment to continue bolstering those services. Our VMAP program, the Virginia Mental Health Access Program, that is bridging the gap between mental health and our healthcare providers, our pediatricians, our primary care providers, is being bolstered with about $4 million in additional funding. Their plan is to expand to perinatal mental health and to expand to early childhood mental health work. So it's really exciting for some of our youngest kiddos in our Commonwealth and their families that also need to be wrapped into this care. We're getting a bolster with some funding for our behavioral health loan repayment program. We have workforce shortages, y'all. We know this. This is going to be really great to help that pipeline of folks coming into the behavioral health field. We know this is not the only investment that they need, but student loans are certainly something I think that is top of mind for many of us right now. So getting some support with that loan repayment is great. And then an $18 million salary increase for our CSB and Behavioral Health Authority staff that will go into effect on January 1. I do want to note that this is quite a bit less than the salary increase proposed by our House and Senate budget. The House suggested investing about $37 million in salary increases, and the Senate recommended increasing the salaries by about $50 million, or investing $50 million to increase the salaries. So this is a bit less than that, a good start, but we do know that our workforce does need additional investment to continue expanding and doing the great work that they are doing. So a lot of mental health investments happening here. We're glad to see it, but as always, there is work to be done, and you will hear more from us about our plans moving into the next General Assembly session to continue the momentum around youth mental health. All right, so you're going to continue hearing from me here. I'm going to do a quick tax policy breakdown for you. Tax policy is something that we lean on CCI, the Commonwealth Institute, for a lot of their expertise on. They lead us in the Tax Fairness Coalition, which Voices is part of, and we have really leaned on them to understand the tax policy implications in our budget. So as Allison said, this was really the sticking point in why our budget has been delayed by so many months this year. And really what we have found and what we see in this budget is that we're getting a modest increase for our state standard deductions. So how this helps families is for single filers, that's increasing your standard deduction to $8,500 for single filers, $17,000 for joint filers. It costs the impact on the budget is about $48.1 million, which is quite different from the nearly $1 billion that was targeted to wealthy families and to corporations in the original budget that was introduced. And the flip side of that is that we will now be getting one-time non-refundable tax rebates. So if you file single, you'll get a $200 tax rebate in this fall sometime. And then if you file jointly, you'll be getting a $400 tax rebate. The compromise with this is that, unfortunately, this is non-refundable, which leaves out some of our lower income friends and neighbors. It also doesn't consider family size. So if you are a parent and you have 3 kids and you file as a single filer, you will get $200. If you are a joint filer and you have 3 kids, you will get $400. It does not take into account how many children you may have in your home, which is something that Voices always advocates for, to consider family size, knowing that having kids is expensive and existing is expensive, and we should be investing our money in our families and our children. The missed opportunities this year is that we unfortunately did not advance legislation to continue strengthening our earned income tax credit or establishing a state tax credit. And so we hope that this is going to be part of a broader tax conversation in the coming years. We'll be working with the Commonwealth Institute on a state child tax credit, and hope that it is something that we can gain support on to support our families and put money back in our families' pockets so that they can meet the needs of their day-to-day life. And I am going to pass it back to Allison to go over the child welfare and foster care investment.
Thanks, Emily. So with child welfare, for those of you who have followed us, we have some of the things that we advocated for, and then some things that were added into the budget at the last little bit here of the negotiation. So I'm going to start with some things that were included in the budget that we advocated for. We have continued to advocate for salary increases to local child welfare workers. We know that the workforce shortage is also impacting the foster care system, and part of that is salary. So we're glad to see that salary increase moving forward. We also asked for training and quality assistance for local DSS staff. The budget put in $10.5 million. The language isn't very specific here, so it's going to be up to agencies to kind of figure out how they spend that money. I'm sure a state will assist in figuring that out as well. They did continue the enhanced treatment foster care pilot program for $1.1 million. We are looking at Virginia creating, it's called different things in different states, but ultimately what we mean is that there will be some foster homes where the family is paid a salary for kids needing to step down from congregate care, where a family placement is not appropriate or available, and a traditional foster home isn't appropriate or available either. The budget also included language for DSS to develop a plan to provide access to statewide kinship navigator program. So I'm hoping that that plan will be ready by December-ish so that they can put forth a proposal in Governor Youngkin's signature budget. We have advocated for kinship navigators, and we see that as a critical part of bolstering the kinship care system in Virginia. Things that were surprises in the budget were $3 million to support the Safe and Sound Task Force. If you'll recall, the Safe and Sound Task Force was about ending the practice of children and youth sleeping in offices that were coming into foster care or having a placement disruption. The $3 million language was extremely vague. It just says support for Safe and Sound Task Force. So as we get more information and details about what they're going to do with that, I'll be sure to inform you all. There was also $3 million to implement a pilot program to increase the number of foster children adopted in Virginia. Again, very vague language. I'm sure they're going to partner with some private providers around means and other things that would increase the number of children adopted in Virginia. There's $200,000 that was put into the budget to cover the cost of coordination, recruitment, and additional training to foster care agencies. And then there was budget language that requires the Department of Social Services to create an emergency approval process for kinship caregivers and develop foster home certification standards for kinship caregivers. We know that a lot of kin caregivers face barriers to placement of their relative children, and this has been brought up by JLARC, by all sorts of advocates. So this is another way for them to address that concern brought up by families and advocates. All right, other things that were included in the budget were $600,000 for a collaborative partnership between local DSS to increase capacity to approve kinship caregivers and recruit and retrain and develop locally approved foster parents. So we also want for some kinship caregivers to become foster parents, not necessarily just kinship care providers. So a kinship foster parent. And there's some money to develop some partnerships with private folks to help that process move faster. There was $8.2 million in the office of, I can't even remember all the language right now because my brain has been in a million places. This was money we expected in the budget. There's a plethora. It's really around improving the state hotline for CPS calls. Most of that money is around child protective services improvements. There was also budget language included to convene a work group to examine the inclusion of residential treatment services and managed care. So there will be a work group developed around that. Thank you, Office of State Inspector General. I was like, my brain is tired and isn't working. I think there's one thing I forgot to put on here before I go into not included in the budget. I think I copied it and pasted something over it, but I'll just talk through it. So Senator Favola had done a bill this legislative session that would have created a foster care prevention program, which was essentially kinship care, and formalizing that into a program where kinship caregivers would receive financial assistance in addition to some case management, and just created a more robust kinship care system that we've been advocating for. That bill died during the legislative session. However, it was included in budget language, which is great. We put out a couple of emails to DSS folks as well as Senator Favola to get more clarity. And DSS right now is working with budget folks to kind of get an understanding of what they can do now that that has been put into budget language. But that's great for all of us that have been advocating this past legislative session around the kinship prevention program. So some things not included in the budget that we did advocate for. They did not expand the child welfare stipend program for BSW and MSW students that we asked. They did not include the parent legal representation pilot program, which I'm really disappointed that they didn't do because it wasn't that much money, but I'm hoping that they're going to include it in the signature budget proposal. They also didn't include the driver's license program that we have asked, I think, for almost now 4 or 5 years. It's such a little bit of money. I'm frustrated that it didn't get included, but I will ask again and again and again because it's one of the priorities of young people. And they didn't include the money for after school care for foster youth. This was sort of a last minute ask, so I'm not too surprised that it wasn't included. And I think we'll be able to do some finessing on that and work it next year. Happy to answer any questions about child welfare and foster care before we move along. Okay.
Okay, well, you can keep using the chat, of course. So we're going to jump over to some healthcare access investments now. There was an investment of $3 million for the Nursing Preceptor Incentive Program. This program already exists. It's a program that helps incentivize physicians, physicians' assistants, licensed practicing nurses. It now adds in registered nurses in conjunction with the School of Nursing to be able to provide clinical education rotations so that nursing students can have access to different environments, particularly psychiatry is included in the budget language here. So really trying to get some registered nurses that will work in the psychiatry units, and in conjunction, really bridging that gap between healthcare and mental health care. So glad to see that additional investment. It brings the total to $3.5 million. So it was pretty significant to see that. DMAS now has the official go to begin the reprocurement process. What this means is they're going to start working with our managed care organizations to really identify what is going to be able to be covered under these managed care delivery service systems, how much what the rates are going to look like in these managed care, like what the managed care will pay for each service. And so the RFPs went out on August 31st, and then they're planning for a summer 2024 implementation. If anyone was on the Right Help Right Now stakeholder call yesterday, some of what was shared is that the plan for the procurement is to reflect DMAS's goals to improve services, to improve delivery, and to improve access within the Right Help Right Now behavioral health focus, in addition to maternal and child health, member engagement, single specialty plans for foster care, and the new technology and quality improvement performance, in addition to some new payment models. So I think the plan, we didn't see all of the rate increases that we asked for within our mental health work. And so I think what the plan is to, in the reprocurement, to really look at some of these rates and to pay more equitably for what these rates cost so that folks can get better quality care. Because what we do know is that with low reimbursement rates comes providers that do not take Medicaid, and therefore leaves a lack of the ability for folks to access services, particularly mental health services that they need in their communities. So the reprocurement process is slated for a summer 2024 implementation. So I'm sure there will be more to come from DMAS. The two caveats in the budget language is that this cannot include any new services in the contract unless it's been authorized by the General Assembly, and it cannot create any future funding commitments unless authorized by the General Assembly. So my guess is through the RFP, if new services come about, there will be some legislation that needs to be put forth, or some budgetary items to make sure that we can cover services. And I think that there will be a specific focus on how we can really implement more true community-based mental health services and healthcare services using maybe community health workers, things of that nature, in supporting folks where they are and when they need help and care. There was $38 million in ARPA funding back in the skinny budget. If you remember the skinny budget that got passed in April, kind of the stopgap, $38 million to support our Department of Medical Assistance Services and local DSS agencies for the Medicaid unwinding that is taking place. That will be a 14-month process. Right now, folks are having their Medicaid redetermined for the first time since the beginning of the pandemic. A lot of folks have moved and changed locations and have had increases in income, or maybe lost their jobs or changes in their household. And so the Medicaid redetermination process is a huge undertaking. DMAS needed to bring in a vendor and a contractor to support. And then we needed to ensure that our local DSS employees were being compensated for their overtime and any additional support that was needed there. So we got that back in April for our agencies. Things that were not covered, both are big bummers, but we will keep working towards, is Cover All Kids. This is led by the Healthcare for All Virginians Coalition, our friends over at the Commonwealth Institute and Virginia Poverty Law Center. Cover All Kids will create a statewide healthcare benefit for children regardless of immigration status. So for children that are not documented or who do not have the citizenship requirements to meet the Medicaid coverage, this would create healthcare options for them. There's about 13,000 kids right now that don't have health insurance simply for these procedural reasons that should have access to a healthcare benefit. And so we will continue working on this with our partners at the Healthcare for All Virginians Coalition. It did make it into the Senate's budget this year, so that is a huge step in the right direction. And we are hopeful that we can find some champions this upcoming General Assembly session to get this across the finish line. Also a bummer that we did not see the Medicaid benefit study for community health workers in the budget. It was a very small dollar amount, $100,000 in general funds. The purpose of this is to do a study to determine how we can pay community health workers to support community members in the healthcare space, in the mental health care space in various spaces, very similar to the doula benefit that was passed 2021, 2022. I'm blanking on which year it was, but we are going to keep working towards this and trying to do some education to our members as to why this is important and look at some other avenues as to how we can get that study rolling and be able to develop a Medicaid benefit to pay community health workers for the great work that they're doing in our communities. Any questions on healthcare access before I throw it back over to Allison? We're kind of ping-ponging back and forth here. Okay.
Great. So early care and education, I think I'm going to start with what's not included in the budget because that's really the big thing. We were really disappointed to see that the package that was passed did not include any additional money for childcare subsidy, Virginia preschool initiative, or mixed delivery. So it really only reflected the current levels that were already in the biennial budget. This is a big disappointment because of the federal child care cliff that we are facing in Virginia and every other in most states. Senator Senator Kane did file some legislation in the federal government yesterday to address the child care cliff. But I was really hoping that the Virginia legislature would take action to avoid about 80,000 children not having childcare. So we are really disappointed to see that. A few things that were included in the budget was an increase to reimbursement rates for early intervention services by about 12.5% for all children under 3 currently enrolled in early interventions in Medicaid. And there was also some budget language that allows the superintendent of public instruction to alter staff to child ratios for licensed child day centers, folks participating in child care subsidy, and BPI programs that are in public schools, and some daycares as well. So there's some greater flexibility open for early childhood. The Virginia Promise Partnership and other key partners are all going to be working with Governor Youngkin and his administration to address the urgency around childcare. So can I explain the childcare cliff? So during the pandemic, there were lots of different measures that were put in place to support families, and one of them was around childcare. Emily, if you don't mind going to our website and pulling my blog down, because it talks about it in much greater detail that I'll do in 30 seconds. But basically that has expired or will expire, shortly. And with the additional dollars that were put in for childcare, about 80,000 kids will lose their ability to have their childcare provided for with federal dollars. There was definitely opportunity for the state to step in to provide that. I think what we're seeing overall, though, is that as the pandemic measures to support families are rolled back, we are seeing sharp increases in child poverty. During the pandemic, we reduced as not just voices, but everyone reduced child poverty by about 50%, which is significant. And as we see these measures roll back, we're seeing not only are families struggling more than they were 3 years ago, we are seeing less available to them. It's like we have all these services going away while inflation is rising, and all these things happening at the same time. So we really need the legislature to act and respond. And if you want more details on the child care cliff, Emily posted the blog in the chat, and I would love if you click the take action button on that article, because it will send an email to our to legislators asking them to act on behalf of the child care cliff that we are currently experiencing. So I know there are a few folks here who are our early childhood partners. I just took over this work from Emily Griffey like a little bit over a month ago. So I'm going to be convening some of our partners again, as she used to. And we're going to talk about what kind of strategy that we want to take, especially now that there are so many other folks doing this work between the Virginia Promise Partnership and the Campaign for a Family-Friendly Economy, all sorts of folks in this space who we all want to achieve the same goals. And I think part of what I'm going to be doing in the next few months is really hearing from you all and preparing to share their stories with legislators. That's it for me. I'm like, am I doing education investment? I can't even remember anymore. Sorry, y'all. We have lots going on here at Voices. So again, our folks at TCI really help us with this slide, as well as our Voices is on the Fund Our Schools Coalition. So just wanted to go over some of the additions and modifications that happened in this budget that we supported. So 152.3 million for the support cap funding. This is all about those support positions in our public schools that we all talk about. If you have a child in a public school, you'll often hear about how the teachers don't have access to those support positions anymore. So this is money that we have been asking for quite a while to support the cap and funding. There was 54.6 million for the state share for a 2% increase to teacher salary. Is that far enough? No. It is, again, one of the priorities that we are pushing for. And then there is 418 million in flexible one-time support for the implementation of the Virginia Literacy Act, learning loss recovery, and additional operating and infrastructure support. What we will see over the next few months is we'll get more and more details about how that is going to be implemented and how far the language can go. Some of the time when the budget comes out, these like in the detail information just isn't available right away, especially because this budget process took so long. We weren't able to do all of the background research that we would typically get to do. So I will say this is really a good start for the educational investments, and I'm hoping to see more prioritization in the signature budget that will come out in December. And thanks, Emily Moore put in the chat some of how that adjustment for the ratios. And Paul asked, we may have a federal shutdown in a few weeks, correct? Impacting Head Start and Early Head Start. Do you all have any news on how budget discussions, are going in DC? From the little bit of conversation that I've heard is that members do not want a shutdown, considering everything else that is going on, right? We just heard this morning that the automotive industry is on strike. And especially, I will say, we have a really great Virginia delegation who understands that a federal shutdown impacts Virginia families very strongly. Like, we have a large percentage of federal employees that live in Virginia. So our delegation is working really hard to do everything that they can to prevent a government shutdown. And is that the feeling amongst everyone? I think the feeling amongst everyone is that families are already struggling so much that we just cannot handle another shutdown. There are always lots of reasons to put it to the edge that I won't get into right this second, but my hope is that we will not have to have that kind of serious conversation in a couple of weeks. But if that does happen, you can look to Voices for what we need to message to members.
Okay, and I am rounding out our budget updates with some additional investments for young people. These are items that we have that are mostly new to us, with the exception of the first item here. So $2.5 million is going to go to the Department of Social Services, where they will work with the Secretary of Health and Human Resources to develop a process for state agencies to get some funding to improve language access. The Virginia Department of Social Services houses the Office of New Americans, and so they are poised to be able to work and facilitate language access amongst our state agencies. This is money that we were hoping would have been $5 million. $2.5 million was in our fiscal year 23 budget, and it went unused. And so we had a budget amendment that would have rolled that money over and made this investment $5 million, but $2.5 million does give us a foundation to start. We have heard from folks that they do have difficulty accessing their social services benefits or other appointments at their CSBs because of issues to language access and services and paperwork not being available in the language that they speak at home. And so we are hoping that this will give our state agencies the resources to be able to hire interpreters, to be able to hire bilingual staff, diversify their workforce to better support our communities. Now, this $10 million for Safer Communities program, like I mentioned, is new to us. So we are still really learning what this is going to entail, what this might look like in practice. This money is going to specifically go to after-school programs, mentor programs, connections from education and economic opportunities, focusing on implementing trauma-informed mental health care in our communities. The budget language says that it will support holistic, community-based strategies to address the root causes and conditions of community violence. And so we are hoping that this money will be directly invested in local organizations that are doing work with their communities to support them to have their needs met, to ensure that we can provide spaces for our young folks to thrive in their communities. It does say that out of the amount, $9.5 million will be provided to Norfolk, Portsmouth, and the city of Richmond. And so those three cities right now are priorities in this the Safer Communities program. It also establishes the Office of Safer Communities under the Department of Criminal Justice Services. And so this will be a new office whose job is to do research, look at evidence and best practices, and identify ways to alleviate community-based violence in our Commonwealth. There's $5 million in additional funding for the Firearm Violence Intervention and Prevention Fund. And there's specific language carved out now that says it supports community engagement and youth programs. So we will be following up on this implementation to ensure that there is money going specifically to our young citizens and our young neighbors and their communities to be able to intervene in instances of community violence and firearm violence. And then a few months ago, and I say a few because I don't really know how long it was, our CEO, Rachel Dean, provided a public comment on the length of stay guidelines that were adopted by the Board of Juvenile Justice, increasing the length of stay for young people in detention. And so in the budget language, the Department of Juvenile Justice is now required to provide a report to the money committees by December 1st of this year on the impact of these length of stay guidelines that were adopted last November. And so we are going to be monitoring that and seeing what comes out of that report, but do not really know what the next step of that will be until that report comes out with some recommendations. So you can look to us in December for some updates on that as well. And that rounds out our budget. We've got some slides here to tell you about some great things that are coming up. Allison, do you want to jump in and kick us off?
Yeah, so if you're interested in getting more involved in either using your voice, telling your story, Kristen Lennox is our Director of Engagement, and her email is right there. She can get you connected to our advocacy trainings, community events, and she can also schedule a one-on-one prep session with you. And go to the next one. We also would love to see you at our Beyond Trauma Youth Mental Health Summit here in Richmond on October 11th, 2023 at the Science Museum of Virginia. We are thrilled to have Dr. Sean Jenwright as our keynote speaker. This summit honestly is appropriate for anyone who is working with young people or children. We are currently offering 50% off tickets using the code educator or counselor for educators and mental health practitioners. However, if you or someone you know really think should be there and cannot afford a ticket, please reach out to myself or Emily Moore so that we can get them a scholarship to attend. We want folks who are going to be impacted by the workshops and the speakers to be there regardless of their ability to pay for a ticket. And that might include your interns who you think are really at the next, going to be going into the next phase of this upon completion of their program. We are also going to be having a lunch and learn with our policy team. We're going to start doing this quarterly. The next one will be on Wednesday, October 4th from 12 to 1 p.m. This will be an opportunity where you can hear from everyone on the policy team and our upcoming priorities, whether it be budget, policy, advocacy opportunities. I know that so many of you work directly with like one person from Voices, but sometimes you have multiple interests in our organization, but you don't want to attend 4 meetings a month. So we will do this meeting quarterly. You can go ahead and register for that with the link that's in the chat, vakids.org/join-us/events. And you can register for our lunch and learn. In addition, the governor will be releasing his signature budget on December the 20th, which is quite late. It's usually on the 15th or the 16th, but that's what it's scheduled for. Voices will quickly turn around a presentation probably the following day or the day after, and we will go into a deep dive on all the priorities that are in the governor's signature budget. We don't have a registration link available for that just yet, but we will soon, and we will share it with you all so you can turn to us and we will flip the budget very quickly and tell you what is in it, and we will also tell you what we need to ask more of.
We have a couple of questions that have come through in the chat that I want to make some space for since we've got a few minutes. Allison, this one is about foster care, so want to pose this to you. What can you share about the rate increases for foster parents that's included in the budget? Are there any details yet?
Yes, I didn't put it on this slide and I don't have it pulled up right. I'm not sure who asked that question, if it's directly to you, Emily Moore, but I can email them
Sure.
But the rate increase was included in the final budget.
Okay, I will. They did message me directly. I'll just ask their email, make sure we get that to you. So if anybody else wants that information, you can drop your email privately, message, or in the chat if you're comfortable, and we can share that out with you or add you to Allison's Foster Care Policy Network.
Yep.
Actually, I think that was the only question. The other one was just about making our slides available, which I shared with folks. We would share the recording and things with them.
Yeah. So this is our policy team. There are some new folks here. So if you have a question on child welfare, early care, and education, you can email me directly and I will get you connected. You can reach out to Emily Moore on healthcare access, family economic security, and food and nutrition access. Our brand new policy analyst, who is in week 2 right now, Cameron, can connect with you on youth mental health, but look to have more of a meet and greet from her at our lunch and learn. And then in addition, she will start to meet with partners here, probably starting next week. Kristen is our director of advocacy and engagement, and she can connect with you on all of these issues. And sharing stories and highlighting, if you're thinking, what else can I do? Kristen's the person to reach out to. Sophia Booker also is brand new to Voices, but not probably new to many of you all. She was at UMFS for quite a while. She is our new advocacy and engagement manager, and she is most closely working with our Virginia Youth in Action. So if you have any questions about youth engagement, please reach out directly to Sophia. And with that, I'll see if there are any remaining questions that we can answer while we're all together. Ashley asked if Voices will be advocating the upcoming session regarding the TANF cliff and all the services that will be impacted by that. Emily, do you want to answer that?
Yes, I think the family friendly, Campaign for Family Friendly Economy has worked on that some as well. Our friends at Families Forward Virginia also often advocate for the TANF cliff. We will be keeping our eyes out for that. I'm looking to see what will be impacted, and we'll of course keep everyone updated.
But ultimately, yes, we will. It will be a priority of our work. Any other questions that we can answer?
And I appreciate folks dropping their emails to me. I am copying them all into a separate Word document, and we will make sure to add you to our list.
Well, we thank you all so much for joining us this Friday morning, and look for more ways for us to connect, whether it be at the summit, our lunch and learns. Please reach out to us if you have questions about tickets. And we look forward to sharing the results of the governor's signature budget in December. I hope everyone has a great rest of their day.
Thanks, y'all.